right, good afternoon, everyone. My name is Danae Aber, and I'm the Executive Director of the Louisiana Rural Health Association. Thank you for joining this National Poisoning Prevention Week webinar, Bright Futures Begin Lead-Free. LRHA is happy to host this webinar presented by the Louisiana Childhood Lead Poisoning Prevention Program. The webinar is being recorded and will be available along with a copy of the slides on the webinar recordings page of our website. Your lines will be muted, and when you join the webinar, please remain on mute to prevent background noise. You can enter any questions in the Q&A box. And then after the webinar, you should automatically get a survey open in your internet browser. Please do complete that as it helps us improve our future events. And so with that, I would like to welcome our speakers, Jonathan Whipple and Madison Puzdrakevich. So Jonathan is the program monitor for the Louisiana Childhood Lead Prevention Program. He has been involved with the childhood lead poisoning prevention efforts in Louisiana for the past 7 years, and he currently oversees the statewide program whose goal is to eliminate childhood lead poisoning through a comprehensive approach, including data surveillance management, increased screening, testing rates, public education, primary and secondary intervention services, and policy reform. He's a graduate from the University of New Orleans with a focus on health promotion and has gained experience in both public health and housing aspects of the effort at the federal, state, and local levels. Madison is the health communication specialist for the Louisiana Childhood Lead Poisoning Prevention Program. Her role is to spread knowledge of lead and lead poisoning in Louisiana in an effort to decrease exposure and increase blood lead testing and reporting rates. She received a bachelor's degree in psychology from Manhattan College in Bronx, New York. She continued her education in New Orleans, receiving a master's of public health in social, behavioral, and population sciences from Tulane. So thank you so much, Jonathan and Madison, for being here, and I will pass off to you.
All right. Thank you so much for that introduction. And hello, everyone, and good morning or good afternoon, wherever you are out there. We're absolutely delighted to welcome you guys today to the webinar on childhood lead poisoning prevention in Louisiana. Again, my name is Jonathan Whipple. I am the program monitor and primary investigator for the Louisiana Childhood Lead Poisoning Prevention Program. I'm really thrilled that you guys have chosen to join us today for this crucial conversation. As we're gathered here today, it's important to recognize the weight of our mission. Our children are our most precious assets, and ensuring their health and safety, it's a responsibility that falls on all of us as parents, educators, healthcare professionals, and community leaders alike. Unfortunately, lead poisoning remains a significant health issue in our state and across the country. So it affects countless families and communities. This issue isn't just historical, it's actually an ongoing challenge that requires our immediate attention. And so today, we'll explore the various sources of lead exposure that many children face here in Louisiana, such as lead-based paint, contaminated soil, and lead pipes in older homes. And we'll also discuss the serious health impacts of lead exposure, including its effects on cognitive development and behavior. Understanding these risks is the first step in our prevention efforts. But the good news is that lead poisoning is preventable. And throughout the webinar, we'll share effective strategies that you can implement in your homes and in your communities to mitigate risks. So we bring a wealth of knowledge and experience, and we're going to offer some insights into best practices for education, screening, and prevention. And I just want to encourage everyone to engage actively in today's discussion. I know that we're recording this, but feel free to reach out to us at any point to ask questions or share your experiences and collaborate with us. Your participation is crucial in shaping our collective efforts to protect the health of Louisiana's children. So thank you again for being here and for your commitment to this vital cause. Together, we can work towards creating a healthy future, lead-free future for every child in our state. And with that, we'll go ahead and get started, and I'll turn it over to Madison.
Okay, great. Should be sharing my screen. Can you see it? Okay, great. So the key messages for today, here they are. We're going to talk about common sources of lead, how lead poisoning affects children's development, the importance of lead screenings for children, especially those at higher risk, the importance of reporting all lead test results to our program, and lastly, we'll discuss how to test homes for lead hazards and explore effective remediation strategies. We'll start by covering what lead is. Lead is a highly toxic heavy metal and naturally occurring element that's found in the Earth's crust. It's been used in many different products over the years, like paints, gasoline, batteries, pipes, and toys. And it's used to increase the weight and durability of products, to make colors more vibrant, and to soften plastic to make it more flexible. The home is one of the most common places to find lead. And in Louisiana, one of the most common sources of exposure that we see is lead-based paint. The use of lead-based paint on houses, products marketed to children, and dishes or cookware was banned in 1978. So homes or products made before then may still have lead-based paint. When the paint peels and cracks, lead chips and lead dust are created. Lead dust can be invisible, and lead-based paint chips are sweet to taste. So anyone can be exposed by inhaling lead dust, and children might want to eat the lead-based paint chips because they're sweet. Drinking water can be contaminated if it passes through lead pipes that have corroded. New lead pipes and plumbing fixtures were banned in 1986, but pipes and plumbing fixtures put in before then likely still contain lead. You don't have to worry about being exposed from showering or bathing unless you're swallowing the water. However, if you have a bathtub that has chipped or cracked porcelain enamel, you should limit bath times for young children and make sure they're not swallowing the water. Soil can have lead. Deposits from leaded gasoline, exterior lead-based paint, and industrial sources have contributed to increased levels of lead in the soil. This is especially common in urban areas and areas with older housing. Fruits and vegetables can be contaminated if they're grown in lead-contaminated soil, especially root vegetables like carrots or turnips. Artificial turf can also have lead, and as the turf ages and weathers, lead is released in a dust that can be ingested or inhaled. Foods, cosmetics, and medicines have been found to have lead. If they do have lead, they're usually imported from other countries with different rules and regulations regarding lead. Lead can get into spices and candies if grinding, storing, or drying ingredients are done improperly. We'll talk about the cinnamon-flavored applesauce pouches that were recalled last year a little later on, but the contaminated ingredient was found to be the cinnamon. Lead has also been found in some imported cosmetics like lipsticks, hair dyes, and eyeliners, and it's been found in some medicinal powders and tablets that are traditionally used by East Indian, Middle Eastern, West Asian, and Hispanic cultures. While it's uncommon for people to die from lead poisoning these days, of course it can still happen. The container pictured on this screen is a hemorrhoid cream from Vietnam, and earlier this year in Sacramento, California, a woman died from lead poisoning because she was using this cream, and it was found to be about 4% lead. Consumer products sometimes have lead. These are usually imported or they're antique. So older toys made of tin and brass might have lead. Jewelry has been found to have lead. The charm bracelet pictured on this slide actually caused the last reported death of a child in the US due to lead poisoning. In 2006, a 4-year-old boy swallowed the charm part of that bracelet, and it was determined that the charm was 99.1% lead. The charm bracelet came as a free gift with a pair of children's Reebok shoes. Plastic toys and other plastic products can have lead. The use of lead in plastics is regulated for children's products in the US, but not many other products. So children's products can't have more than 100 parts per million of total lead content in accessible parts. And when the plastic is exposed to sunlight, air, or detergent, the chemical bond between lead and plastics breaks down and releases a dust, which can be ingested or inhaled. A 2016 study tested Mardi Gras beads for lead, and they found that 33% of the sampled beads had lead content higher than what is allowed in children's products. Some adults have jobs or hobbies that expose them to lead, and they bring the lead home with them and expose their families. Some jobs with lead hazards are construction work, painting, and any profession with firearms. A lot of ammunition is still made with lead. You can see that on the picture in the screen with the lead bullet and the copper bullet. Some adults also have hobbies with lead hazards, and some hobbies with lead hazards are working with stained glass, pottery glazing, home remodeling, furniture restoration, and fishing. A lot of fishing weights are also made with lead. Emerging sources of lead are usually children's products that were imported and they get recalled. The garden set and the jewelry set pictured on this slide were recalled last month due to lead. You can find a list of recalled products on the Consumer Product Safety Commission's website, which is cpsc.gov. While everyone can be exposed to lead and suffer lead poisoning, there are certain groups at a higher risk. So children are at a higher risk for lead exposure and lead poisoning if they are younger than 6 years old, if they live or spend time in a house or building built before 1978, if they're from low-income households, if they're recent immigrants, refugees, or recently adopted from less developed countries, and if they live or spend time with someone whose work or hobbies exposes them to lead. Women who are pregnant and women who are breastfeeding should also be aware of the sources and risk of lead exposure. The amount of lead in a pregnant woman's body and her fetus are almost the same. And while only about 3% of maternal blood lead is passed to the infant during breastfeeding, there is no safe blood level for children. So why are younger children at a higher risk? Children absorb a higher percentage of ingested lead than adults. Adults typically absorb about 20% of ingested lead after a meal and up to 60 to 80% on an empty stomach, while children absorb about 50% of ingested lead after a meal and up to 100% on an empty stomach. Young children are also at a higher risk because of their hand-to-mouth behavior. The most common source of lead exposure for young children is lead dust that they swallow after putting their hands or other objects in their mouths. And lastly, the health effects of lead poisoning are much more harmful for young children than older children and adults because younger children's brains and nervous systems are developing rapidly, making them more sensitive. So lead inhibits the bodies of growing children from absorbing iron, zinc, and calcium. These minerals are essential for proper brain and nerve development. The body accumulates lead over time and normally releases it very slowly. Because of this, consistent exposure to low levels of lead can sometimes have the serious harmful effects that are associated with high levels of lead. And high levels of lead in the blood can cause lack of muscular coordination, poor hand-eye coordination and reaction time, convulsions, coma, and death. And low to moderate levels of lead in the blood can cause lower IQ, damage to the brain and nervous system, growth and developmental impairments, deficits in behavior such as hyperactivity, aggression, and violence, learning disabilities, attention deficit disorder, hearing problems, and headaches. In times of stress, particularly pregnancy and lactation, the body can mobilize lead stores, and that increases the level of lead in the blood. So if a mother has been exposed to lead over a long period of time or has had high levels of lead in her blood in the past, the lead stored in her bones can be released into the blood during pregnancy. And too much lead in a pregnant woman's body can put her at risk for miscarriage, cause the baby to be born too early or too small, damage the baby's brain, kidneys, and nervous systems, and cause the child to have learning or behavior problems later on in life. There are a lot of ways to reduce the risk of lead exposure. Keeping homes clean and dust-free is a great way. Wet cleaning is recommended, so that just means wiping things down with a wet cloth or mopping instead of dusting or sweeping, which can actually spread the dust and lead dust into the air. Because lead is absorbed into the body the same way that calcium and iron are absorbed, eating a diet high in calcium, iron, and vitamin C might make children less likely to absorb lead if they are exposed. Of course, you should wash children's hands and toys regularly, and always wash their hands outside before eating and before going to bed. It's best for children to play in grass, not loose soil or dirt. You can also cover the dirt with mulch or wood chips or use a sandbox. If you're doing any remodeling or renovating on a house that was built before 1978, you should hire certified lead professionals. You should also keep pregnant women and children away from the work areas. If you have a job or hobby that you know exposes lead, you should shower and change right when you get home. You can also leave your shoes outside, and you should wash your clothing separately from the rest of the household's clothing. If you're not sure whether or not your house has lead pipes or plumbing fixtures, and you haven't used your house's water in at least 6 hours, you can flush out the possible contaminants. And you can do that by running the water for a few minutes, taking a shower, doing a load of dishes or laundry. However, each individual line does need to be flushed. So if you wake up and you take a shower to flush out the main line, then you want to get a glass of water from the kitchen sink. You should run the sink for a few minutes or until the water gets cold. That's a good way to know that it's been flushed. You should also only use cold water for drinking and cooking. And lastly, have children tested. Testing is the best way to know whether or not a child has been exposed, so it's very important. Millions of children are affected by lead poisoning every year. The American Academy of Pediatrics estimates that 1 out of every 4 homes with children under the age of 6 has lead contamination. Many children who have lead poisoning look and act completely healthy, and the effects of lead poisoning can be irreversible. So who should be tested? Children should be tested once by the age of 1 and twice by the age of 2. Also, all children who are at a higher risk for lead exposure, like the groups we covered earlier, should be tested. There are 2 types of blood lead tests, the capillary, which is a finger prick, and the venous, which is a blood draw. There is no safe blood lead level for children, so the CDC no longer uses the terms level of concern or elevated. They now have a blood lead reference value, which is 3.5 micrograms per deciliter. This was lowered from 5 to 3.5 in 2021. So capillary tests are usually used for the initial screening, and venous tests are used to confirm capillary results that are at or above the blood lead reference value of 3.5 micrograms per deciliter. So this is the CDC's recommended schedule for obtaining a confirmatory venous sample. As you can see, the higher the blood lead level is on that initial screening, the more urgent it is to have the confirmatory test done. And this is the CDC's schedule for follow-up blood lead testing. Again, the higher the blood lead level is, the more frequently follow-up testing should occur. And follow-up testing is very important because the blood lead level should start to decline if the source of exposure has been removed. And if the child's blood lead level increases, it's very likely that the child is still being exposed. So now I will pass it over to Jonathan to talk more about our program.
All right, thank you so much. Okay, so switching gears a little bit, the Childhood Lead Poisoning Prevention Program is a program of the Louisiana Department of Health's Office of Public Health. We're actually housed within the Bureau of Infectious Diseases, section of Environmental Epidemiology and Toxicology, or SEAT. The SEAT section is also home to several other programs, including the Adult Heavy Metals Program, Environmental Public Health Tracking, Disease Cluster Investigation Program, Emergency Response Program, which covers things like chemical spills throughout the state. We have an occupational health and heat-related illnesses program, Louisiana Fish Advisories, indoor air quality, and the Private Well Owner Network Initiative, as well as a couple others. Our section chief is Shannon Swallow. Colette Duhay provides general oversight and supervision for several of the programs within SEAT. And for the Childhood Lead Program, we have myself as the program monitor and primary investigator. We do have a public health epidemiologist who oversees all of our data collection and surveillance efforts. And we also have 2 full-time and 1 part-time case managers and care coordinators who provide follow-up services for all of our lead poisoning cases, which we'll talk a little bit more about. Of course, we have Madison here, who you've already met. She oversees all of our education and outreach efforts. And we also have 2 student workers from the Xavier University, who help us with data entry. In addition to that, we also have contracts with 3 lead inspection and risk assessment firms. All of our investigations for our lead poisoning cases statewide. And we'll talk a little bit more about what that entails as well. But for now, I'd like to read our mission statement. Our mission is to eliminate childhood lead poisoning in Louisiana by employing a holistic strategy encompassing prevention of lead exposure, effective management of children exposed to lead, and advocacy for lead-free environments and other safety measures. Our vision is to proactively identify children vulnerable to lead exposure, enabling the implementation of preventative and corrective measures before any exposures occur. We are dedicated to boosting rates of screening and reporting of blood lead tests by medical providers to help us pinpoint high-risk areas throughout the state. We also aim to empower citizens to eliminate lead hazards in their own homes by providing educational resources, conducting environmental investigations, and facilitating referrals for remediation services. We are primarily funded through a grant from the CDC. The state of Louisiana has actually been a recipient of this grant since the late 90s, and we're currently in year 4 of our grant project period. And this grant has allowed us to enter into a cooperative endeavor agreement with the CDC and establish a collaborated work plan, which includes 3 main strategies. Those 3 main strategies are: number 1, ensuring blood lead testing and reporting; number 2, enhancing blood lead surveillance; and number 3, improving linkages of lead-exposed children to recommended services. So all of our activities within the program fall under one of these 3 main strategies, okay? And so for the next slide, I wanted to give an overview of the services that we provide. They include the collection and surveillance of blood lead test data for all children less than 16 years of age. So every child under the age of 16 that receives a blood test, those results come to us, and we maintain a database to monitor blood lead levels throughout the state and to provide follow-up services for children who have been identified to have those blood levels above the reference value that Madison talked about, which is that 3.5 micrograms per deciliter or above. For our case management and care coordination services, we provide those for children less than 6 years of age who have a confirmed blood lead test, that's a venous test, with the result of 3.5 or above. And we provide a lead risk assessment questionnaire for the level of 3.55. So if they have a level of 3.5 to 5, we conduct this this lead risk assessment questionnaire, which is a 9-page long form questionnaire that we conduct with the families over the phone to help them identify potential risk factors associated with their homes, their jobs, their hobbies, and it helps them identify sources of lead that might be present in their environment so that we can then provide them with recommendations for removal of the source or protection of the children from those sources of lead. Now, for children less than 6 years of age with a confirmed level at 5 or above, that's when we offer the full environmental investigation that are conducted by one of our certified lead risk assessment firms. Okay, and we'll go a little bit more into depth on what that entails in just a few minutes. But lastly, we have our education and outreach arm, and this allows us to not only provide trainings like this one, but also educational resources, raise awareness about lead poisoning throughout the state, and just not only to raise awareness about the importance of lead testing and reporting by medical providers. Okay, so as we mentioned, this is one of our main goals, is to increase the testing and reporting rates throughout the state. And so for the next slide, what does the state law say about testing and reporting? Well, the administrative code, the Louisiana Administrative Code, requires that all medical providers who provide routine care to children ages 6 months to 6 years who spend more than 10 hours a week in the state of Louisiana, they should be tested for lead in accordance with the CDC's recommendations and guidelines. And as Madison mentioned earlier, we know that children should be tested once by the age of 1 and twice by the age of 2. Okay, so the administrative code also calls for the mandatory reporting of these results to the health department, regardless of their level. So to be clear, all lead test results are required to be reported to the state health department, even if those levels are less than the reference value. Okay, so there's a couple of ways that facilities can report to us, and one is through the OPH electronic lab reporting system, and the other is by faxing a lead case reporting form, which we'll see on the next slide. So as you can see, this is yet another lengthy form that would need to be filled out by the facilities and faxed over to us. So there's been a big effort along with the folks over at OPH to reach out to facilities throughout the state to get them onboarded into our ELR system, or our electronic lab reporting system. We believe this will not only increase efficiency for the facilities as it relates to the requirements for reporting, but it also helps increase efficiency in collection and monitoring end. Okay. With the next slide, what you'll see here is the number of cases that have been reported to us with a confirmed blood level above the reference value, which means that the children who have received a venous blood draw with a result of 3.5 or higher. Okay, so as you can see here, we still have a majority of our facilities reporting through the fax machine. And we've had a total of 902 cases that we've responded to over the course of a 12-month period from June 23 to May 24. So you can see why it's important for us to try and get more facilities onboarded into our ELR system. For the next slide, we have a map of the 9 LDH administrative regions. You can see down there in Region 1, that's going to be Orleans and Jefferson Parish area. In the Northwest section of the state, we've got the Shreveport, Region 7. Monroe is going to be up there at the Northeast. That's Region 8. Then we've got Region 5 down there in the Southwest. That's going to be like the Lake Charles area. Right there in the middle, or central Louisiana, we've got Region 6. That's going to be your Alexandria. And then Region 2 there, that's going to be Baton Rouge, obviously our state's capital. So for the next slide, we've got a breakdown of the number of environmental investigations that we've completed over a 12-month period. Okay, so as you can see, Region 1 as having our largest number of cases. So that's where New Orleans is located. It's our biggest hotspot. Okay, obviously it's the state's largest urban area. It's got a lot of older housing stock. There's a huge population of folks living under the poverty level, which is a huge factor. Big risk factor. And then Region 7, they're coming in as our second largest number of cases, and Region 4, Lafayette area, coming in fairly high as well. So for the next slide here's where I wanted to explain our environmental investigation process. As we mentioned earlier, we do offer this service for children less than 6 years of age who have a confirmed blood level at 5 or above. So basically, once we identify a case as being eligible for the environmental investigation, we make contact with the family to offer them education on lead poisoning and to offer them this free investigation. Okay, so once we receive their consent, we send a referral to one of our certified lead risk assessors in their area, who then makes contact with them to schedule an appointment. Okay, so when they go out and do the investigation, they're going to do a full lead-based paint inspection using a handheld XRF analyzer. The inspection entails testing every painted surface inside and outside of the home from top to bottom. They're going to collect samples of dust from all the windowsills and floors in the house. They're going to take samples of soil from around the home. They're also going to collect water samples from the main source of drinking water, which is typically going to be the kitchen sink. And they're going to be looking for any and all potential sources of lead that might be present in and around the home. They're going to send those samples that they collected out to a laboratory to be analyzed. And once they get the results back, which generally takes about a week or so, they're going to put all of those results, their findings and recommendations in a report, which they then send to us. And we share and review that report with the families and property owners if necessary. Now, these reports can be pretty lengthy and fairly technical, so we always make sure that we take time to review these reports with the families to make sure that they know what's included in it, what was included in the report, what's included in the investigation, what the recommendations are, and to talk to them about, next steps on how to remove sources of lead from their home, and hopefully refer them to any services that might be available to them in their area. If the house is identified as having lead-based paint hazards, we are required by the Louisiana State Sanitary Code to send a referral for the house to be posted with a lead hazard notice. So the notice is actually going to be like a placard that goes on the front entrance of the dwelling. It basically states that lead hazards have been identified at the home. Now, this does not mean that the house is condemned. It does not mean that the family has to move out. It's simply a means of notifying anyone who enters the home that there are lead hazards present, and that children, pregnant women, and other vulnerable people should not enter the home. This is, again, the notice has to remain posted until all the lead hazards have been remediated in the house, and it must pass a lead clearance inspection. So once a property owner feels like all the lead hazards have been remediated, they can call us back and we'll have the inspectors go back out to perform a lead clearance inspection, excuse me. The clearance inspection includes a visual assessment as well as taking dust wipe samples to make sure all the lead sources have been safely removed. And once the house has passed a clearance inspection, then the notice can be removed by the sanitarians. Okay, and what we see here, and as Madison mentioned earlier, is lead-based paint and lead-contaminated dust are our leading sources of exposure. I also wanted to point out here that the blinds, there are actually mini blinds that were produced with lead as late as the early 90s. They're often found in mobile homes, and we're actually still finding them in homes throughout the state. And also the food there, that's going to be generally going to be things like spices that are imported from other countries like Latin America and Asia. And on the next slide, you'll see one particular food product that was identified at the end of October last year, and we're still responding to, is the contaminated applesauce product that you see here. This product was being distributed throughout the country and in Louisiana. And what we had here in our area was the Wanabana brand that you see all the way to the right. This was being distributed at Dollar Tree locations throughout the state, as well as online through Amazon. And the contaminated product was actually the cinnamon, which was being added to the applesauce. And this was coming from a manufacturer based in Ecuador. The CDC and the FDA were involved in a thorough investigation where they actually went out to the facility in Ecuador where the product was being made. And it was determined that lead chromate was actually being added to the cinnamon during the grinding process. Lead chromate has been used to increase weight as well as enhance coloring for pigments in paint as well as spices like cinnamon and turmeric. Our program worked in collaboration with the state sanitarians on a thorough recall audit of all of the Dollar Tree locations in the state to make sure that the product was removed from the shelves. We also provided response efforts to families of children that had consumed the product. And we responded to a total number of 22 cases, ages range from 10 months to 2 years. The next slide, we have a breakdown of the regions where these cases were from. As you can see, it was pretty equally spread out throughout the state, okay? I think that's about all we got. So next slide. Yeah, so, okay, so just in closing, again, thank you guys so much for joining us today. I'm really encouraged to have you guys here and for this informative session. I hope you feel inspired and empowered to take action in your communities. As we wrap up, I wanted to reflect on what we learned. Lead poisoning remains a critical public health issue, especially for our youngest and most vulnerable citizens. The impacts of lead exposure are profound and they're long lasting, affecting not only the health, but also the cognitive development and future opportunities. But we have the power to change that narrative. And today, we shared some information about the sources of lead, the importance of screening kids, and ways that we can prevent exposure. And we discussed practical strategies for families, community leaders, and healthcare providers to work together in creating safer environments for our children. Remember, prevention starts with awareness. So each of us plays a role in that, whether it's educating ourselves, our families, and others, advocating for policies that protect our children, or ensuring homes and schools are free from lead hazards. Together, we can build a foundation for bright lead-free futures for all of our kids. So as we conclude, I just want to urge you to take the insights and the resources that we shared today and put them into action, okay? Let's continue the conversation. Please share this knowledge within your networks and continue to commit to a future where every child has an opportunity to thrive unhindered by the effects of lead poisoning. So thank you once again for your participation and dedication to this important cause. Please stay safe, stay informed, and let's work together to ensure bright futures begin lead-free.
All right, well, thank you so much to Jonathan and Madison for your presentation, and thank you guys for joining us today. As a reminder, as you exit the webinar, there will be a brief survey that will pop up. Please do take that for us. And a recording of the webinar along with the slides will be available on our website in the next couple of days. And I did put that link in the chat, and it will also be in the follow-up email that comes from Zoom. And as always, please feel free to reach out to us if we can be of any assistance or if you have any questions. And I'll just give any last comments from either of our speakers before we wrap up for today.
Nope. I just you guys have our contact info. So if at any point you guys want copies of the slides or additional resources, we do have a really good website that has tons of information and resources there. But if at any point you guys want to reach out to us, please don't hesitate. We're here and we'd love to collaborate with you guys or offer any additional resources that we might be able to provide. So yeah, thanks again, and take care.
Awesome. Thanks so much. Have a good afternoon.
Thank you.